101.4 Spice FM, Nairobi.
3,000 shillings, courtesy of Safaricom Home Fiber, is coming your way. All you need to do is one of two things. One, if you've never subscribed, then you can dial star 400 hash. Subscribe to the Safaricom Home Fiber. They will call you. They'll bring somebody to come and do the installation for you free of charge. They'll bring you the equipment required. That's a router and all the cables free of charge. And you start enjoying high speeds. If you just do 2,999 a month, that's the bronze package. It has 15 Mbps of speed. If you do the silver one, 4,100, 30 Mbps of speed. Previously it was 20. Safaricom has invested in redundancy systems, improved their network. So now more speeds and higher speeds. If you do any of that, send us a screenshot of your payment and the message that you receive from Safaricom. You stand a chance of getting the 3,000. Or if you're already subscribed and you renew your subscription, or you've recently renewed your subscription, send us that screenshot. We see you have done that. We know that you're a user, that you're already enjoying this improved lifestyle. You also could win the 3,000 shillings. Moses Kuria, Senior Advisor to the President, is our guest. CT.
Mheshimiwa, you said something very interesting, and you painted a very graphic picture of the rot that was in NHIF.
Mm-hmm.
Now, let's have this imaginary situation where the rot was eliminated and had not been there. Would the system still have required change?
Yes, because of one thing, and I like that question. What we're implementing today, once we implement, it is important to ask ourselves, we will be like which country? We'll be on the same level as which country in matters health? And the answer is very simple, like none other. Not even in the United States.
Mm-hmm.
Nowhere else, not even in India, nowhere will be like a country with no parallel in terms of healthcare. This is M-Pesa 2.0 in terms of global something.
Leapfrogging and leading the world.
Yeah, why? In other countries, you'll find a very good public system. In the UK, for example, they have what we call the NHS, the National Health Service. As we speak, there is a waiting queue for months. Some of the operations, if you want them at the NHS, there is a waiting queue in the system for months. And that is for public hospitals only. There is nowhere in the world where you'll find a system that connects from, not even from the lowest facility. Let's start from the lowest. Do you know which is the lowest level of unit of hospital that is going to be in SHA?
Mm-hmm. It's a domestic, it's home.
Home. Thank you very much.
Uh-huh.
Thank you very much. From home.
Mm-hmm.
From home, the home is now a hospital. Yeah? All our households are now our hospitals connected in the system.
Mm-hmm.
A doctor known as CHP, community health provider, still in the system. Level 1 hospital, dispensary, level 2, level 3, level 4, level 5, level 6, all the way. From Kenyatta, all the way to a homestead in a place called Kanyamkago, connected in the same system. Yeah? In the same system. Yeah? Never seen. 2, a system that connects both private hospitals, public hospitals, faith-based hospitals, all in one. Never seen that. Never seen that. Because right now, and by the way, some people are telling me, I had an argument with someone from Embu over the weekend, telling me, now, this SHA cannot work unless now we improve the facilities in our, the services and the facilities we uplift in the public hospitals. I said, I wouldn't care less. I said, why? Because now, once you are covered, you come from Mama Rusi Hospital to St. Francis Hospital. One is public, the other one is private, without a care. The package is the same. You go to public hospital, you go to private hospital, you are covered in exactly the same way. So you go to Mama Rusi Hospital and you find that the accused is dilapidated, people are rude. You simply go to Ruai Family Hospital and you get the treatment there with the same package as you'd have gotten to Mama Rusi. So what will that do to our public hospitals? What that will do is that now the game is up. They have to, up their game, or they disappear from the face of earth. Luckily for them, one of the laws we passed, as you mentioned in the beginning of this show, the Facilities Improvement Fund is available only for the public hospitals. Why is the Facilities Improvement Fund necessary? It is actually an affirmative action. Realizing that the private hospitals will overrun the public hospitals, it is telling the public hospitals, governors, please take this money, go and improve your hospitals. And if you don't improve your hospitals, patients will vote with their feet and they will go to where they can be able to get good service, and so they'll go to the private hospital. So if you look at that, again, patient data portability. I come from my village dispensary, same data. I go to Gatundu Level 5 hospital, same data. I go to Aga Khan, same data. I go to Kenyatta, same data. So all these data, whereby, and it's on your phone. You can be able to use your phone and say, look, on this date I went to Karen Hospital, or this date I went to Mama Lucy, or this date I went here, I did that. Another thing, my good friends, the doctors, and I warned them during the doctor strike. Now, this thing of going to Kenyatta for 2 hours and then going to your private to meanguka na wao. Yeah, because now you go to Kenyatta, you log in. Every health worker will get a device. They have to log in. So again, and it will be publicly visible. Dr. Eric Latif, morning, 7 to 9, Kenyatta. 9 to 2 p.m., Latif Private Hospital. 10 to 11, so you have to decide. You are a public doctor or a private doctor. So if you look at, coming back to that question, City, if you look at now that compared with the NHIF, it's actually like, they see where I come from, comparing death with the sleep.
Okay.
It's just two different animals altogether.
I agree completely. It makes perfect sense, and I like the picture. A small problem here, though, because even with the system upgrade, because this one is a mega system upgrade, but it will be run by people. The route we speak of is not mechanical. It's not digital. It is people and their ways. How will we avert this same issue with the
people that we have?
Yes, because this program is going to be implemented by Kenyans with Kenyans. And the people who gave us the rot in NHF were Kenyans. We didn't import them, and now we're deporting them. Same people.
I like this. I really like this, because the question you ask is really at the heart of the system. When I was a student of finance and accounting at the University of Nairobi, Professor Nzomo taught me one thing, that fraud is a formula, and he gave me a formula. Fraud is equals to ability multiplied by opportunity multiplied by desire. Please note that one. Yeah? Please note that one. Yeah?
Ability, opportunity, desire.
Ability, opportunity, desire. All of us have got ability to be good thieves. If you want to be a thief, you just use your brain, you can. Most people, many people, not most people, or a good number of people, have the desire to cut corners and do bad things. The ones that you are describing, City is describing. The only thing at your control is opportunity. And what this system does, it minimizes, may I dare say, it brings it to almost near zero, the opportunity to commit the things that were being done. So I can run this system with exactly the same people, or most of the people who are running NHF. But my friend, I have given you the example of doctors. I've given you the example of people that claims. I've even told you about medicines, which were being taken from KEMSA. You find when we are ordering from KEMSA, the system is working. Ikifika kwa hospitali, the system inafungwa. The medicines are received manually. Jioni unaikuta hapo kwa Kamutini Hospital. Hapo nyuma. Now we have tightened, because now even the KEMSA system for the commodities, and even the Pharmacy and Poisons Board for the tracking and tracing of the commodities is locked in the system. So this system was not made for good people. And it was not made for mature people.
Okay.
This is a system we have made for thieves and for children, for kids, for idiots. It's not for clever people. Yeah? You know, it's what we call in technology a system for dummies. We have created a system for dummies. We have assumed that everybody, unlike the rules of natural justice, everybody is a thief until proven otherwise. Yeah? And everybody is an idiot until proven otherwise, you know.
Okay.
And that is really the ideology behind, you know, the way we have programmed, this system, that knowing very well human beings are prone to temptation. And if the human beings are prone to temptations, Kenyans, as a special species of human beings, is even prone to more temptation. We made a system with that ideology, with that frame of mind.
Okay. You mentioned some of the things that used to happen under the NHIF, and that was, we do know that, you know, riddled by graft for years, NHIF, it was, you know, people were taken to court, things like that happened. Apart from some of medicine moving around, what were some of the things that happened under NHIF that this system essentially is going to shut the taps on so that we can understand that from what you see? But before you answer, I would like your reassurance that I still am worried about people who are going to seek care today